Taping for anterior knee pain is also a very, very useful technique in relieving symptoms just temporarily while you're receiving treatment. And all we're trying to achieve by doing that is just to move the kneecap marginally inwards by a few millimetres or just a small amount of area so that the two bones aren't irritating and creating further erosion. The technique's known as the McConnell technique, named after Sydney physiotherapist Jenny McConnell, who devised the technique some 20 or more years ago. And simply all you'll require is some zinc oxide tape. You'll need some sort of a dressing or protective cover, either in a second skin or a skin prep, or some type of dressing like a fixable. It comes in many different types of forms. This is called a Metfix as well, so they're all quite similar. So we'll just cut up a couple of sections of dressing, and we'll apply that to the front of the knee joint, primarily to protect the skin, more so than doing anything else really. So all we're going to do is follow where we're going to tape so that the skin is protected, and then a second bit underneath that as well too, which helps, just gives a little bit of extra protection. That's it. And while you're taped up, you can actually load up the joint without really exacerbating the symptoms, the anterior knee pain. So to actually tape up the kneecap, we just cut little strips of tape, zinc oxide tape like so. We start off laterally and attach just to the outside part of the kneecap. The inferior pole of the kneecap is right there, or the bottom part of the kneecap is there, the top part of the kneecap is there, and as you can see, just relax for a moment for me, Alyssa. As you can see, the kneecap is quite mobile, and what we're trying to achieve is we're trying to achieve an inwards and marginally upwards position of that kneecap, as if we're holding that kneecap up and across in that position there. So the tape is going to take the position of my hand. Instead of holding it up like so, I'm going to use a tape underneath, and it's going to just suspend that kneecap up marginally across and upwards. So we push that kneecap in, hold it there with my thumb, and then I just stretch the skin and apply the tape underneath and attach like so. That's all that is. And then we just do an extra couple of pieces as well, just so we can maintain that and reinforce that. Once more, push the kneecap inwards, stretch the skin, take that up and attach. There shouldn't really be any wrinkles in the tape, nor should there be any wrinkles in the skin if we stretch that out properly. And the reason we're doing that is that it doesn't concertina back when we release the pressure. So we again stretch that across and push underneath, and what we've now done is created almost like a little bit of a suspension area there. As my hand's holding the kneecap up, we can release that now, and anybody with anterior knee pain syndrome can achieve immediate relief of symptoms just by doing this very, very simple technique.